Hi everyone, in today's video we will be going through USMLE questions on dermatomes and CNS findings in HIV-related dementia. So let's start with the first question. A 40-year-old man is rushed to the emergency department after falling from a significant height onto his abdomen and lower extremities. He sustained blunt trauma to his abdomen and lower limbs, but has no injuries to his chest, head, or upper limbs. A rapid ultrasound assessment reveals a splenic injury with blood accumulating along the posterior aspect of the diaphragm. In which of the following locations is this patient most likely to experience pain due to diaphragmatic irritation? When answering this question, we need to understand a couple of important concepts about referred pain and the innervation of the diaphragm. The diaphragm is innervated by the phrenic nerves, which arise from C3 to C5. This means that irritation or injury to the diaphragm, like what happens with a splenic injury, is often felt in regions that are served by the same nerve roots of C3, C4, and C5. This phenomenon is called referred pain. The options which are provided here are A. Periumbilical area of the abdomen, B. Axilla, C. Shoulder, D. Hand, E. Nipple area of the chest. The correct option here is C. Shoulder. In this case, because the spleen is injured and its blood pools along the diaphragm, the irritation of the diaphragm typically corresponds to the pain in the shoulder. This pain occurs because the diaphragm is innervated by the C3 to C5 spinal segments, and the shoulder is within the C3 to C5 dermatome. As a result, the brain interprets the pain from the diaphragm as if it's coming from the shoulder. This is a classic presentation of referred pain in splenic injuries. Let's have a look at why the other options are incorrect. So option A is incorrect because the abdomen at the level of the umbilicus is typically innervated by the T10 dermatome. And option B is incorrect because the axilla is primarily innervated by C8 to T1, which is located far below the C3 to C5 dermatome. And option D is incorrect because the hand is innervated by the C6 to C8 dermatomes. And option E is incorrect because the area of the chest at the level of the nipple corresponds to the T4 dermatome. Let's have a look at the second question. A 40-year-old woman with a long history of untreated HIV infection develops progressive cognitive decline. She eventually succumbs to a secondary opportunistic infection. Autopsy reveals diffuse cerebral atrophy. The photomicrograph provided shows a section of the cerebral cortex. Which cell type is represented in cluster of cells located in the center of the image? Now, when approaching this question, focus on a few key concepts. First, consider the patient's history. She has AIDS and develops cognitive decline, which is dementia, and it's a common complication of HIV affecting the brain. The autopsy which they have done reveals cerebral atrophy, indicating a neurodegenerative condition like AIDS dementia. And finally, pay close attention to the photomicrograph and the cluster of cells. This should prompt you to think about which cell types are typically involved in AIDS-related brain damage, particularly in cases of HIV infection. And understanding these aspects will guide you for the correct answer. Now, the options given here are A. Astrocytes, B. Ependymal cells, C. Microglial cells, D. Neurons, E. Oligodendrocytes. In here, the correct option would be C, microglial cells. Now, if you notice, the photomicrograph on the right side shows multinucleated giant cells, and these cells are composed of microglial cells. Now, microglial cells are the macrophages of the central nervous system, and, they are the primary reservoir for the HIV within the brain. When HIV infects these cells, it causes them to fuse, forming multinucleated giant cells. This fusion will trap the virus in the brain, and it's thought that this contributes to the development of AIDS dementia. Let's have a look at why the other options are incorrect. Option A, the astrocytes are crucial for repairing the central nervous system, and while they can be infected by HIV, they don't play a central role in AIDS dementia. They do not form multinucleated giant cells or contribute directly to the progression of AIDS-related dementia. And option B is incorrect because the ependymal cells, they line the ventricles in the brain and are not involved in the pathogenesis of AIDS dementia. These cells do not form giant cells or have a role in the HIV infection within the brain. So this makes option B also incorrect. And option D, the neurons. While neuronal destruction is part of the disease process, neurons themselves are not the source of multinucleated giant cells seen in the brain. Therefore, this option is also incorrect. And option E, we have the oligodendrocytes. These cells are responsible for synthesizing myelin in the central nervous system. However, they do not contribute to the development of AIDS dementia, and they don't form multinucleated giant cells. So to summarize, the correct answer would be microglial cells, and these are the cells which are key players in AIDS dementia, as HIV infects and causes them to form multinucleated giant cells. I hope this helps to clarify the question and the rationale behind the correct and the incorrect answers.